Hello friends, welcome to MedLife. Today we will be studying a topic of pathology known as inflammation. So what is inflammation? It is defined as the local response given by a vascularized connective tissue towards the injury from circulation to the site where they are needed to eliminate the offending agents and further proceed towards cell repair. Inflammation is a protective response by the body to a variety of etiological agents, that is infectious or non-infectious, because it serves the host to get rid of initial cause of cell injury, that is microbes and toxins, and secondly the consequences of cell injury, that is necrotic cells and tissues. Inflammation is distinct from infection. Infection is invasion by harmful microbes, that is bacteria, virus, fungi and parasite into the body and their resultant ill effects by toxins. The mediators of defense in inflammation is WBC or phagocytic leukocytes, antibodies and complement proteins. The consequences beared by a cell without inflammation are: number 1, infections would go unchecked, wounds will never heal, and secondly, injured tissues might remain permanent festering sores, that is infected producing pus. So basically there are 5 series of steps involved in an inflammatory response, and those are: number 1, recognition of injurious agent, number 2, recruitment of leukocytes and plasma proteins, number 3, removal of agent, number 4, regulation or control of response, and 5th is resolution or repair. And there are 2 types of inflammation. Number 1 is acute and number 2 is chronic. Now we will understand both types of inflammation by taking an example. So once we all have been suffered from tonsillitis, right, which is an example of acute inflammation caused by Streptococcus pneumonia, and tuberculosis is an example of chronic inflammation caused by Mycobacterium tuberculosis. Both are caused by bacteria. Now whenever this bacteria, that is Streptococcus pneumonia, gets entered on our body, it will cause tonsillitis disease within 3 to 4 hours. So its onset is very rapid. So number 1 point of acute inflammation is rapid onset. Time between entry of microbe to first symptom is known as onset. And tonsillitis is cured within 6 to 7 days, that is it is of short duration or short lived, and edema is formed in that part, and the edema is the hallmark of acute inflammation, and polymorphonuclear neutrophils are the main inflammatory cells in acute inflammation. So here are 4 points in acute inflammation. Those are rapid onset, short-lived, polymorphonuclear neutrophils as inflammatory cells, and edema is characteristic feature, also known as hallmark of acute inflammation. Now in other situation, if a person is having tuberculosis, then the bacteria, that is Mycobacterium tuberculosis, when gets entered in the body, it stays in the lungs for years. So when the immunity of a person is dropping, at that time they will suffer from tuberculosis. At that time basically the symptoms is seen, that is it has late onset in the case of chronic inflammation. And if the person will take treatment, it will last for almost 6 months, and if he will not take treatment, then it will last for years. So it has long duration. Here the hallmark of chronic inflammation is granuloma formation, which is a characteristic feature, and the main inflammatory cells in chronic inflammations are lymphocytes, macrophages, monocytes as inflammatory cells. So the features of chronic inflammation are late onset, longer duration, lymphocytes, macrophages or monocytes as inflammatory cells, and granuloma formation is its characteristic feature. Now let's see the causes of inflammation. So there are 5 causes. Number 1 is infective agents, that is bacteria, virus, fungi, parasites or toxins. Number 2 is physical agents, that is heat, cold, radiation or mechanical trauma. Number 3 is chemical agents such as organic and inorganic poisons. 4th point is immunological agents, that is cell mediated and antigen or antibody reaction. Number 5th point is inert materials, that is foreign bodies. Now let's jump into the acute inflammation. So there are 5 cardinal signs, or we can say external manifestations, shown by our body. These are the responses which are shown by our body during inflammation, and those are: number 1 rubor, that is redness; number 2 calor, that is heat; number 3 is tumor or swelling; number 4 is dolor or pain; number 5 is functiolasia, that is loss of function. And the first 4 signs was given by Celsus, and number 5th cardinal sign is given by Virchow. So this is one of the important topic. Question may arise from here that what are the cardinal signs. Now question arises that all are Celsus signs of inflammation except A. pain, B. swelling, C. cyanosis, D. redness. So comment down your answer in the comment section. So the acute inflammation is of 2 types, that is vascular events and cellular events. In the vascular events there are 5 steps, and in cellular events there are 6 steps. So here we can see there are 5 steps in vascular events, and those are: number 1 transient vasoconstriction of arterioles; number 2 persistent progressive vasodilation; number 3 elevate the local hydrostatic pressure; number 4 increased vascular permeability; and number 5 is slowing or stasis. And there are 6 cellular events, and those are: number 1 migration and pigmenting; 2 rolling; 3 adhesion; 4 transmigration or diabetes; 5th chemotaxis; and 6th one is phagocytosis. Now question arises that why these vascular and cellular events are taking place in acute inflammation. For understanding this, let's see this figure. So this is the skin, and below the skin here we have blood vessel, this one, which is lined by endothelial cells. Inside blood vessels we have RBC, WBC and platelets, but currently we are only concerned on WBC. Now if any microbe is intruding inside our skin, The microbe may be bacteria, virus, fungi or any parasite. So this is the microbe or injurious agent, and we want both of them, that is WBC as well as microbe, to fight. So if the microbe will win, then we will have infection, and if the WBC wins, then there will be inflammation. For fighting, they should meet each other. So how will they meet? Since the microbe is extravascular, that is, it is present outside the blood vessel, and WBC is intravascular, that is, it is present inside the blood vessel. So if you want them to fight, we have two options. Number one is either the microbe should be taken inside the blood vessels, which is bad option because it will cause sepsis of all the organs. Number two is that we can take this WBC out of the blood vessel, so it can fight with the microbe and infection or inflammation can take place. So all the 11 events, that is of vascular as well as cellular events, are directed towards taking this WBC out of the blood vessel. We cannot take WBC out directly. There are some mechanisms to take out this WBC. So there are 11 steps through which WBC will come out of this blood vessel, and finally it will fight with the microbe. Now we will proceed with the vascular events, and then we will proceed towards cellular events of acute inflammation. So now let's proceed with the first event of vascular event, that is, as soon as the microbe enters into the body, there will be focal vasoconstriction of the blood vessel, as you can see here. Here we can see this part of the blood vessel has undergone vasoconstriction. It is known as focal vasoconstriction because it only lasts for a few seconds. So the number one event which occurs in vascular event is known as transient vasoconstriction of arterioles. Irrespective of the type of cell injury, immediate vascular response is of transient vasoconstriction of arterioles. It means it lasts only for a few seconds. And if we see from above the skin, due to focal transient vasoconstriction, there is less supply of blood at the region of vasoconstriction. So the skin will look yellowish, that is known as blanching. Blanching is nothing, it means that the skin looks yellowish due to less or decreased blood supply, which is due to vasoconstriction. So it is responsible for blanching, which is seen immediately after injury. With mild injury, that is, it lasts only for 3 to 5 seconds, and in the case of severe injury, it will last only for 5 minutes. Now let's come back to the second step of vascular event, that is persistent progressive vasodilation. So immediately after the focal or transient vasoconstriction, there will be persistent progressive vasodilation, and it will occur mainly in arterioles, but also it can affect venules and capillaries. So in this figure we can see, as soon as the microbe enters, after due to transient vasoconstriction, there will be vasodilation, that is persistent progressive vasodilation, and it will last for only few hours. And if we see from above, we will see this portion of skin it will look more red, that is rubor, which was the cardinal sign of inflammation. And since there is more blood, that is increase in blood will result in increase in heat, that is calor, which is the second cardinal sign seen in second step of vascular event. So this portion of skin which has undergone vasodilation will be more warm in comparison to the other portions near it. So both rubor and calor, it occurs because of vasodilation. So both cardinal signs, that is rubor and calor, has been explained here. Vasodilation results in increased blood volume which will cause redness, that is rubor, and warmth or heat, that is calor, at the site of acute inflammation. So that was all about the second step of vascular events in acute inflammation. Now let's see the third step or event of vascular event, that is elevate the local hydrostatic pressure. So according to Starling's law, in any capillary there are two types of pressure. Number one is hydrostatic pressure, that is the pressure due to water, it is outward pressure. And number two is osmotic pressure, that is the pressure due to proteins, that is albumin basically, and it is inward pressure. So normally they are balanced with each other. Now think, this portion of the capillary is dilated, that is there is increase in blood, which means there will be increase in water, which will increase hydrostatic pressure. So the fluid from the capillary will come out and it will accumulate outside of capillary, which will lead to edema. That is transudate type of edema. Since here only fluid leakage is there, so it is known as transudate. But if there was leakage of proteins along with fluid, then it is known as exudate. So here in the third step of vascular event, we have seen that there is leakage of fluid into the extracellular space causing edema, and it is known as transudate. And swelling at the local site of acute inflammation is known as tumor, that is it is one of the cardinal sign. So the tumor, which is the cardinal sign, is seen in the third step of vascular events, that is elevate the local hydrostatic pressure, that is increased in hydrostatic pressure. So let us stop here in the third step of vascular events. Tomorrow we will continue from the fourth step of vascular event, which is quite big in comparison to the other steps. So thanks for watching my video. If you have any queries, comment down in the comment section. Thank you. Please like, share and subscribe.